Okay, let's talk pneumonia, shall we? Good morning, Dr. Senyo.
Good morning.
Great to see you.
Good to be back.
Yeah, good to be back. Last week we missed
Very
you.
good to see you.
But my point before we even start is that a lot of the things that we discuss on this platform, do not take them for granted. The fact that you don't see them manifest in anybody around you doesn't mean you shouldn't pay heed to whatever is said here. All these things are serious matters and you need to really consider them. It could happen to the person next door. So we're talking about pneumonia this morning. Listen attentively to Doc and whatever he says. Okay? It's very essential.
Okay, class is in session.
Oh, no, seriously.
No,
There are times people just turn on the television set and they're just watching you go up and pneumonia. Then that's it. Yeah, you just go.
That is true.
The day it hits you, that's when you realize that.
You know, when you mentioned that someone here lost their father, you know, through pneumonia, you know, it quickly, I mean, I saw the faces of everybody here. You know, people always wait to hear something happen to them next door, or like to happen to somebody next door or to them before they take it serious. Pneumonia is a killer. And the reason it's a killer is this. Of all the functions of the body, we know that breathing is one very essential thing. Without air, people will die. All right. Now, this air is in the atmosphere. I mean, is in our atmosphere. And what we need particularly from it is oxygen. And oxygen is about 21% in the atmosphere. When we breathe in air, that air goes in there and then reaches the lungs, which is in the chest.
Okay,
now,
can I interrupt you very quickly?
Right.
Let's take a quick look at something, then we'll come back and continue chatting with you.
No problems.
Pneumonia is an infection in one or both lungs. It can be caused by fungi, bacteria, or viruses. In Ghana, it kills more children under 5 than HIV and AIDS, malaria, injuries, and measles combined. And though the numbers are declining, with nearly 1 million deaths a year, there is no room for complacency. Symptoms of pneumonia can range from mild to life-threatening. No one is immune to pneumonia, but there are certain factors that can raise your risks. People who have had a stroke, have problems swallowing, or are bedridden can easily develop pneumonia. Infants from birth to age 2 are at risk of pneumonia, as are individuals aged 65 or older. People with weakened immune systems are at increased risk of pneumonia. Drug abuse increases risk. There are more than 50 types of pneumonia. For people who are young and healthy, pneumonia can almost always be treated successfully. Those who are older, have heart failure or lung disease, pneumonia could be harder to treat. There is the need to see your doctor right away if you have persistent symptoms of cough, shortness of breath, chest pain that changes as you breathe, and an unexplained fever. Preventing pneumonia is always better than treating it. Keep your immune system strong by following these healthy habits. Eat healthy, sleep well, avoid smoking, exercise, reduce stress, and avoid drinking alcohol excessively.
I like the reduced stress. Patrice, okay. All right, but yeah, on a more serious note, we're talking about pneumonia, and you started off by saying it's a killer.
Yes, right.
Okay.
And from the video, we saw that, you know, the lungs have this functional unit called the alveoli. Now, these alveoli are like the most efficient exchange machines. By that, I mean they pick the oxygen that comes through the air you breathe and send it straight into your blood. And then at the same time, they take the waste gases from your blood and send it out when you breathe out. Right. So this means that the oxygen that the body needs to thrive for all the metabolism and the rest to work, you know, is getting into the body through these alveoli. Now, when you have pneumonia, whether it's caused by viruses or it's caused by bacteria or any other thing, sometimes chemicals and drugs too would cause what we call pneumonitis. When you have pneumonia, there is inflammation in that zone where this air exchange happens. All right, and then there is fluid accumulation and sometimes pus collection over there. So what happens is that this unit that is supposed to be taking air into your blood has been compromised. Air takes up the places that usually should, fluid fills up the places that are supposed to be taken up by the air. So basically, you have reduced your capacity to take in oxygen.
Okay.
Basically, it means that you are strangling yourself, all right, with pneumonia. So let's say that pneumonia takes just a small section of the lungs. It won't be a problem because you breathe with the rest of the lungs.
Yeah.
Now, when it takes over a bigger portion or is widespread, dotted all around, then it means that this reduce in functionality is widespread and is bigger.
Right.
So the person, if we are looking at strangling the person, is now being strangled completely.
Okay.
So you're not getting any air in there. Basically, that's what kills people. The fact that air does not get into the body. So the brain doesn't get oxygen, is not able to command the rest of the body to work well, and then the ramifications go on and on. Sometimes the organisms, in terms of when it's infective pneumonia, these organisms that are causing the problem could eat into the structure of these alveoli, and blood vessels are just next door. Remember, we said that the air goes into the blood. So these organisms then find their way into the bloodstream.
You have an infection.
And now that blood is able to go anywhere. And so you see infection getting into the blood and causing what we call septicemia. Sometimes these organisms can thrive so well because the fluid that is collected there with the phlegms, mucus and everything is good food for them. So then they begin to proliferate or increase in numbers, causing more damage, causing more fluid. So you see that somebody will develop what we call a lung abscess. Basically like pus collection in the lungs. And this can destroy the lungs irreversibly.
But how can you detect this?
Right. Now, the common symptoms are the ones that we saw on the screen. Someone will come down with a cough. Commonest. This cough could be an infection in the upper airways. We saw the trachea and the bronchioles and all of that. Now, if it's in the upper airways, sometimes we take it for granted. We think, oh, it's just a common cold. I have a sore throat. I just have a little cough. It's true that for somebody who is immune, like immunocompetent, your body can just counter these infections easily.
Right.
But sometimes these organisms sink down with the mucus and phlegms that we produce and gets into the lungs and form a haven where they can proliferate and cause problems. And so we shouldn't take cough lightly.
Okay.
Sometimes if you have a cough with a fever, it already means that these organisms might find their way into your blood or are causing certain things that are being manifest in your blood. That's why the fever is coming up. You might get difficulty in breathing. Like we said, if water or pus or mucus takes over these air-filled spaces, then air is not getting into you enough. So your body compensates by letting you try to breathe faster. All right? So you have difficulty in breathing. Now, these places that are filled with air as well, are not with water as well, are not able to expand like they should when we breathe in. You know, when you breathe in, your chest expands to take in the air. So water has now taken that place, so you are not able to expand. So you get difficulty and pain on breathing, especially when you breathe in deeply. So you see that you have a cough, you might have a fever, then you have chest pain, difficulty in breathing. All right. Now these things should alert you that this cough is not just a normal cough. You need to go to hospital. Now I can't end without saying this, that for children and adults, mostly above 60 or 65 years, you might not get all of these symptoms. And so that is why it gets very confusing. For adults, the elderly, sometimes what happens is that probably they don't even have the strength to cough much. And usually their breathing is not that deep. So you find that they get very confused. Now this confusion comes from the fact that not enough oxygen is getting to the brain. So you have an adult who has a cough, a bit of difficulty in breathing, and now as if, when he talks, you don't get, the point. He's confused about certain things. It could be a sign that there's pneumonia that's getting worse. Now children as well, especially under 5 and especially under 2 years, who cannot talk, who cannot tell you how exactly they feel. How do you see that they have pneumonia? And that brings to mind a study that was done at Confanoche Teaching Hospital in Kumasi, where they were trying to find out some of the risk factors for the causes of death in pneumonia. By now, we all know that it's a leading cause of death in children under 5. We quoted 1 million. Thankfully, now the figures are not so bad. Last year in 2015, pneumonia killed about 922,000 children, which is less than the 1 million that we know, but it's still bad. One death from pneumonia is one too many. All right. So they were trying to find out what could be leading to the death. And we saw from that study, a study of, they studied about, I think, 228 patients, divided into people who were sick and people who were not. Babies who were sick and those who were not. They realized that ignorance was number 1. And that goes with what the WHO also thinks, that pneumonia kills people more in Asia and Sub-Saharan Africa because of lack of knowledge and poverty. Now, lack of knowledge in identifying what is wrong with a child. Most of the mothers that were interviewed at Konfanochi didn't know what pneumonia was about. Some of them had heard. They didn't know what caused it. Some of them thought that it was spiritual. Some of them thought that it was something that started from the pregnancy period and all of that. And most of them didn't think that it was a reason to send a child to the hospital. Now, with those children, you might find that they have just a cold. And, you know, the distance from the upper airways to the chest, where pneumonia plays, is really, really short in children. You see, as you grow taller, this distance also increases.
Doc, sorry, we need to interrupt. There's PK on the line to talk to you. Good morning, PK.
Good morning.
Yeah, thanks for calling. Doc is here.
Yes. My name is PK Bucho from Kaswa. I want to find out. I had pneumonia long ago, about 20 years plus ago. Sometimes the pain I had on my legs, the side of the rib, reoccurs when the weather is very cold, or when the weather is very cold. What contributes to that? This part of the pneumonia. So the pain I had during that, the experience I had, still reoccurs when the weather is very cold.
Yeah, that happens a lot. You see, when you have pneumonia, especially when it's not being properly treated for all of that water and pus to go, sometimes what happens is that there is a little area in the lung tissue that, still has a bit of that pus, and the body tries to wall it off. All right, and keeps it there. Typically, that happens in tuberculosis, which is also another lung infection. But the body walls it off, or it heals that area, and because it's been destroyed a lot by the pneumonia, it heals it by scarring. So when you have scar tissue or walled off area, which does not expand as much as it used to be, then anytime you are called upon, not only when the weather is cold, anytime you are called upon to use more lung capacity, for instance, during sex, during exercise, when the weather is cold, you tend to breathe in more, aggressively, because all your airways, are a bit engorged to warm the air that goes in. So you breathe in with more energy. When your lungs try to expand, that area that does not expand, it's no more elastic, is forced to be pulled apart, and that causes a lot of pain.
So does he need to go for
he definitely needs to see a doctor. We probably will need an x-ray to see that area. But I tell him one thing that works. Taking paracetamol and doing deep breathing in and out exercises will force sometimes those areas that are too attached or too taut to tear off bit by bit as you exercise the lungs, and then it could correct. But he definitely will need to see a doctor first.
Deep breath. Can you do that?
And especially, you see, when you have pneumonia, one of the things that does not help, that leads to this complication that the gentleman has, is that because your lungs are filled with stuff and you are not able to breathe, and especially when the breathing is a bit painful, what happens is that you breathe only up to your comfort zone. So you see that when you're taking a deep breath, it's painful, so you stay on the shallow breathing. Now, it doesn't afford air to go into the areas of the lungs that have been collapsed or that are filled with fluid. So after a long time, when those areas are so adhered, they are not able to come off. And then this can cause this problem.
What about the exposure to air from the fan and from the air conditioner?
Environmental, causes are also...
Diane wants to talk to us before we answer that. It's very essential. Good morning, Diane.
Good morning.
Well, thanks for calling. Doc is here.
All right. I have my little boy. and he's in the crutch.
Damn.
And then at that time, I have to take him to school. Like the kids always have cold, but I try to make sure that he doesn't get cold. But sometimes he gets this little cough. I take him to the doctor. He checks on him. He maybe says there's no infection, but he's okay to go. And then when I take him back to school again, he starts to get this cold and cough and all that. And I'm getting really confused and scared by watching the pneumonia thing because he doesn't like heat, and I always have to keep him maybe somewhere close to the fan. But at every time he's getting cold and cough, and I'm getting so really scared.
Do you take him to the same doctor every time?
Yes.
No, you have to swap. You have to switch around a little bit just for confirmation. But
the main problem is the fact that that child is exposed to other children who have respiratory tract infections, and that's a big issue. I mean, even for my wards, where they go to. I think that schools have to be helped. Sometimes you have a good school, but there's no proper health policy.
Right.
Sometimes I've had the occasion to tell, my wife not to let the children go to school because they have a bad cough or a cold. And then we call the school and tell them other parents should do the same. Right. Now, anytime you are exposed to organisms that will cause an infection, if your immunity is not that strong, you will get that infection. And we know that respiratory tract infections come, you get them, you get transmitted through droplets.
Okay.
So a child sneezes, is talking, the air that comes from the nose, organisms are there, goes into another child. Even the children who will touch their runny nose and everything, not wash their hands and touch other children, could easily infect themselves.
What advice would you give to this young lady, though?
Now, the advice I would give is for her to see the authorities in that school.
Right.
And advise that, all parents will not bring their children when they have a cold, a bad cold, or get those children to be seen by a doctor. Now, one thing that helps children a lot, in preventing these infections, is the use of multivitamins and vitamin C. These will help them, to fight common infections. The other thing is immunization.
No, go on. It's an answer to a question.
Right. Now, the other thing is immunization. We should make sure that all children by the age of 1, and now we know by 2, would have completed the program for immunization in this country. Children who are born in other countries should also follow those immunization schedules. We know that there are vaccines now to prevent some of the
so immunization is very essential. Okay, Richard.
Yeah, good morning.
Good morning.
My problem is, since I was somewhere 10 years, I play ball. When I play ball for some time, I can get a pain in my stomach. And it continues up to now. Now, I'm at least 34 years. I cannot exercise seriously.
Okay, now, hang in there for our star question.
Yes.
Have you
seen
a
doctor?
Have you spoken to a doctor about this before?
No.
Okay.
For 10 years.
Richard, take Dr. Senyo's number. It will appear on the screen. Call him after the show, okay? Thank you.
And for the young lady who also called before, go see Senyo for an alternative one, okay?
Please do. Please.
And then just a quick one. You see, I know that we are forming a big Jigwe family on health. So you see, if you want to be a Jigwe native, you should have the habit of 1, asking questions, 2, researching on your own, 3, going to the doctor.
Right.
It's very, very important. So sometimes when you call me, some people call me and all I tell them is, go see a doctor. And I'm so grateful. This advice is there. I mean, it's with you. See a doctor anytime. And then when you need second opinion and you call me, I'm ever ready. But the first step is to see any doctor, not just Dr. Senyo.
Back to exposure to from the fan and from
so important. It's as important as smoking. It's as important as exposure to kitchen smoke.
Right.
It's as important as exposure to dust. When you sleep under, a fan, whether it's ceiling or standing, what happens is that you are forced to breathe in air that is being pushed in a current by that fan.
Right.
All right. So as we sit here, there's air circulating around. But if we had a jumbo fan here, it will be pushing the air currents towards us. So whatever is being carried in that air whether it's somebody's droplets from their breathing or coughing or sneezing, whether it's from fungi that are growing on your wall or ceiling, or dust or mold in your clothes, is being forced directly into you. So it increases the chances of introducing organisms into your body.
Okay, so it can increase your risk.
Yes, it can increase your risk.
How easily can pneumonia be treated?
Oh, pneumonia can be so easily treated when it is caught early.
Okay.
And that's why the key is to go to hospital early. And the use of antibiotics in bacterial pneumonia and starting them early is also very, very important. I know that in advanced worlds, there's a criteria for diagnosing pneumonia where they want to see evidence from maybe a radiograph or x-ray that something is happening in the lungs. Today, the WHO is making us understand that, especially in poor resource countries, we should have a high index of suspicion, especially in young people, in children and adults above 60. We shouldn't take cough lightly. So the symptomatology or the clinical signs are one that should lead us to begin treatment and then investigate further. By that, we mean you should see the right people, because sometimes just throwing about antibiotics is also not the right thing. And then completing your course of antibiotics when you are given is key. Because you see, that brings us to what we call, how do you call it, community-acquired pneumonia, hospital pneumonia, healthcare-related pneumonia, and the rest. What happens, especially in hospitals, is that because most of the people over there are being treated with antibiotics and the rest, people are on ventilators and they're on intravenous antibiotics and the rest, sometimes when care is not taken, the organisms that you get around there are resistant to some of the antibiotics. So such infections become more difficult to treat. And then when the pneumonia has also caught on farther, has gone into the lung tissue, has gone into the blood, it becomes more difficult to treat. Now, the complications of pneumonia are the causes of death. So we don't have to wait till we have lung abscess or we have septicemia or things are degenerated into something else. Those are the points that the hospitals will lose lives.
Wow.
You know.
It happens.
Doc, it's always good talking to you. I always get excited when we speak to you.
Look, call if you have any question, any health issue. Like Doc said, it doesn't have to be him, it can be anyone. But since he's here now, his number is on the screen. Call, send a WhatsApp message, get some information that could save your life. You never know. You never know.
All right. Doc is always our savior when it comes to health matters. Doc, thank you so much.
Thank you very much.
It's always a pleasure having you.
It really is.
Trust me, it's always a pleasure having you.
It's like a family with you guys.
Right. Okay. All right.